The concept of spirituality in nursing isn't new. It's been around for many, many years. It's been around since the inception of nursing. So even in ancient times, it was believed that people were more than just a human body, and although it was difficult to define, it's just as real as the physical body. In many faiths, it was considered a religious obligation to care for the sick, and also keep in mind that the earliest hospitals in the United States were run by religious orders and nurses that were trained by Catholic sisters, of course. So nurses didn't describe their duties in religious terms, but they did believe that the care they provided was honored by God. Spirituality was almost completely removed from nursing curriculum during the 1970s and 1980s, and that's because the education of nurses was moving more into colleges and universities. But then, as you know, nursing became a profession with our own theories and educational methods. And so at that point, the professors wanted to start looking more at the more of nursing. And that is what makes nursing unique, what makes it effective. So the question then was asked, what is the more? So as nurses, we often do more than just a physical assessment, do more than our nursing interventions. So the ability to assess and address the spiritual needs of patients has become the more of nursing. So authors of nursing texts that wrote about spirituality back this idea that spirituality affects the patient's whole being. Spirituality affects quality of life. It affects health. It affects a sense of wholeness. But spirituality can be very difficult to define because it's very subjective and because we can't see it. So, and also because it's, very unique to every individual. So spirituality emphasizes that connectedness with nature, with other people, inner harmony, an improved relationship with the divine, you might say. And it can be an essential part of one's religion, but you don't have to have religion to be spiritual. Individuals can view themselves as being very spiritual, believing that there's a transcendent being, but not really have any association with a religion. So Dr. Ruth Stoll wrote chapters about spirituality in nursing texts, and this is around the 70s and 80s. And so this is how she defines spirituality. It is who I am, unique and personally connected to God. That relationship with God is expressed through my body, my thinking, my feelings, my judgments, my creativity. My spirituality motivates me to choose meaningful relationships and pursuits. Through my spirituality, I give and receive love. I respond to and appreciate God, other people, a sunset, a symphony, and spring. Spirituality allows me to reflect on myself. I'm a person because of my spirituality, motivated and enabled to value, to worship, and to communicate with the holy and the transcendent. So that is the definition of spirituality according to Dr. Ruth Stoll. So defining characteristics or defining attributes, different aspects of spirituality are beliefs and values, energy, self-transcendence, connectedness, faith, and hope. So spirituality is an inherent human characteristic in that it exists in all people, regardless of their cultural beliefs, regardless of their religious beliefs. It gives individuals the energy they need to discover themselves, how to cope with difficult situations, and also to maintain health. So energy is generated by spirituality. It helps patients to feel well, and it guides choices made throughout life. Spirituality also enables people to love, to have faith, to hope, to seek meaning in life, and nurture relationships with others. So self-transcendence is like authentic connection to the inner self, rising above the self, relating to what's greater than the self, feeling like you are one small piece of the entire puzzle of a greater whole. So an example is human beings with nature and the universe and a divine power. So it doesn't matter what that divine power is, it doesn't matter what that greater thing is, but it's just greater than the self. Connectedness is being interpersonally connected with others, being transpersonally connected with God or the divine power or an unseen higher power. And then through connectedness, patients are able to see beyond their current stresses and find comfort, find hope, find empowerment through their spirituality. And then faith, and that's just a belief in something that can't be seen or heard. So in the context of health, faith represents a confidence, a force that's at work, and that there's hope for a positive outcome. Hope is linked to faith, but it also can have an emphasis on the fear of the unknown, but it can be something to live for and to look forward to, thinking about future goals and outcomes. And then beliefs and values are those things that we hold true. So these can be religious convictions. It can be teachings, experiences that provide moral direction. And just keep in mind, beliefs and values vary greatly from one individual to another. So thinking about the continuum of spirituality, we have sorrow and despair on one side and soaring, empowered spirit on the other side. So spirituality is about not just the day-to-day life we live, but it's also about those times of deep sorrow, those times that when we feel empowered and that we are bursting with joy and happiness. So a spiritual response is when you experience the moment in life that you want to hold on to forever, those feelings, those thoughts, those experiences that can fundamentally change some parts inside of you. So things like a birth, a marriage, a death, a terminal diagnosis. Those things are related with great joy and also deep sorrow. And all of those things have the ability to touch our spirit and to change us in some very profound way. Spirituality is universal, of course, whether someone associates with a specific religion or not. But everyone has something inside of them where they get meaning in life and purpose from life. So even if a person is atheist and they have no religion, they don't believe in God, they still can be very spiritual. So spirituality helps individuals achieve the balance that they need to maintain health and well-being and also to cope with illness. So a lot of times nurses neglect the spiritual dimension. And why is that? Why do some people not go there, neglect the spiritual dimension? Well, one reason is lack of time, lack of resources. It's something that's not scientifically based, and so sometimes we may not be comfortable with it just because we can't see it. So it's also important to note the concepts of spirituality are often associated with religion, and so people might not be comfortable talking about that with their patients. However, we need to keep in mind spirituality is so much bigger than religion, and it's more unifying. So some nurses may not believe in God or a divine power, and they might be uncomfortable talking about the topic. Also, there might be some nurses that have very strong religious convictions, but they may not want to talk to their patient about spirituality because they can't listen to someone else's belief without imposing their own, and that's hugely untherapeutic. And again, another barrier is just a lack of time. So it's important to remember that spirituality and religion are different. So spirituality is a person's experience of and their belief of a connection greater than themselves, that they find meaning and purpose. So religion is the outward practice of a system of beliefs. Religion is a book of codes, so to speak, you can think of it like that, of moral codes to live your life by. So things like church attendance, how one worships, communion, those are associated with religion and not with spirituality. Let's talk about some specific NANDA language that we can use to define terms of nursing diagnosis. So the first one is spiritual distress. And spiritual distress is suffering when someone's unable to find meaning in life. So through the interconnection and a connection with others, there's a connection with the world or a higher being, and this causes people to question who they are. It causes them to feel doubt or loss of faith, a sense of being alone or abandoned. And so a person with spiritual distress is going to question their own spiritual values. They might question life itself. They might question the purpose of living and question their source of meaning in life. So that is the definition of spiritual distress. Signs of spiritual distress: crying, fear, anxiety, guilt, questioning identity, disinterest in those normal spiritual activities, anger, hopelessness, inability to pray if they usually pray, a sudden change in spiritual practice. So think about a difficulty connecting to the spiritual self, to others, to music, art, literature, a difficulty connecting to that power greater than self that they believe in. Spiritual assessment. It's important for us to think about how we assess someone's spirituality. And so some things that we can do is to be present, to listen to their story, trying to determine their personal belief system, asking them questions to get more information about their personal belief system, and then just ask them, what gives your life meaning? So some questions of spirituality and spiritual health are, for example, which experience in the past have been most difficult for you? What gives you energy during difficult times? Which aspects of your spirituality have been most helpful to you? Which aspects of your spirituality would you like to discuss? So when we look at faith and belief, one of the things we need to know is if our patients have a religious belief that's going to conflict with medical treatment. So there's a huge amount of religious diversity in the United States, and so we need to make sure that as patient-centered nurses that we are supporting them when possible with their decision-making and our decision-making about nursing care. So questions on life and life responsibility. How do you feel about the changes this illness has caused? How do these changes affect what you need to do? Questions on life satisfaction. How happy or satisfied are you with your life? What accomplishments help you be satisfied with your life? Questions on connectedness. What feelings do you have after you pray, if you pray? How do you feel after you meditate? Who do you feel is the most important person in your life? And with rituals and practice, are there ways that we can intervene to help you as the patient continue your practices in the way that you usually observe? So there are some objective tools that we can use to assess spirituality. There are several of them. I have a couple examples on this slide here, and you don't need to know these for the test. I just want you all to know that there are tools that you can use to assess someone's spirituality. So this first one called FICA, F is faith, I, importance of influence, C, community, A, address. That just means, addressing interventions. So questions, do you consider yourself spiritual or religious? What importance does your faith or belief have in your life? Are you part of a spiritual community? How would you like me or how would you like us here at the hospital to help you address these issues regarding your healthcare and spirituality? So on this slide, you will see different nursing diagnoses. So spiritual distress, risk for spiritual distress, readiness for enhanced spiritual well-being. Of course, that's my favorite when we say readiness for enhanced something. And you can read the list of the rest of them: moral distress, anxiety, and so on. So in your nursing care plan with spirituality, you want to have some goals for spiritual distress. So, and also make them specific, specific and timely. So if a person is going to express meaning and purpose in their life, that would be something you'd want to hear them verbalize, during their hospital stay. Expressing a sense of hope in the future, expressing connectedness to self and others, all of those kind of things. So nursing interventions. One nursing intervention is you can use one of those assessment tools that I mentioned. You can individualize your nursing interventions to enhance their spirituality. So things like music therapy, reminiscence therapy, humor. Also very, very important is therapeutic communication, making sure that you're present with your patients. So active listening to their stories, encouraging them to tell their stories, being reflectful, using humor, using therapeutic touch when appropriate. All those things are considered to be part of therapeutic communication. Facilitate any religious needs. Is there any kind of special music they'd like? Is there a way, do we need to know if there's times that they're praying and they don't want to be interrupted? How can we assist in any of their religious rituals? And then desired outcomes and goals would be things like expressing purpose and meaning in life, sensing some kind of hope for the future, sensing a connectedness with themselves, with others, and then finding meaning in relationship, and then another really, really important one is the ability to accept their diagnosis and to cope with their illness. Okay, so here is another nursing diagnosis. So we talked about spiritual distress. Now let's talk about religious distress. So religious distress is impaired ability to exercise resilience on their beliefs and participate in their religious rituals or any kind of faith tradition. About just difficulty using those specific religious beliefs or rituals, feeling distressed from being separated from that faith community. All of those things can be considered religious distress. So here are some risk factors for religious distress: life transitions, aging, an end-of-life crisis, illness, pain, any kind of history of religious manipulation, insufficient social support, any kind of cultural barriers to practicing religion, any kind of environmental barriers. So hospitalization is an environmental barrier. If they are unable to leave the hospital, then they're unable to attend their church. So we don't want any of our patients to have religious distress because their religious distress can tie into their spirituality. We want them to have hope and meaning in their life. And why? Well, it's because they're going to have better health outcomes if they have a more positive attitude, if they feel connected, if they have hope and better coping. So we're looking, for better health outcomes. Religious nursing interventions for religious distress. So, of course, we want to encourage participation in usual religious rituals, anything that's not detrimental to their health. We want to encourage any use of prayer or meditation when appropriate. And if needed, we can always refer them to the hospital chaplain. We can refer them to any religious leader, counseling, or support group. And for the outcome, our desired outcome, we want our clients or our patients to express satisfaction with their ability to use religious practices, express satisfaction with their ability to access religious rituals. Okay, so another important nursing diagnosis you need to know is moral distress. So we have spiritual distress, religious distress, and then we have moral distress. So moral distress is being unable to act upon what we believe is the most morally appropriate action to take. So when you act in a way contrary to your personal and professional values, that is moral distress. If you, do something that you feel is against your religion or is against your belief in spirituality, that's moral distress. If you know what to do, but you can't do it because of some kind of external reason or internal reason, that is that is moral distress. Some risk factors, oftentimes we'll find this in end-of-life issues. A risk factor can be conflict among decision makers, conflicting information for decisions, any kind of cultural incongruence, loss of autonomy, physical distance or separation from the decision maker, time restraints, treatment decisions. All those things can be risk factors for moral distress. Signs of moral distress are going to be someone expressing turmoil or anguish about acting on a choice that they're making. And there's two parts of the impact. The first impact, there's frustration, anger, guilt, anxiety. There can be self-blame, there can be withdrawal. And then the second part is those feelings that accumulate each time that things happen, or, like with a subsequent event. So continuing guilt, the accumulation of that sense of shame or self-blame. And so think about the three patterns of response. The first one is, conscientious objection. So that means voicing opposition to the plan of care, refusing to follow specific orders. The second one is desensitization, and that's, just being passive, being withdrawn. The third one is a strong, ongoing physical stressor or psychological stressor, and that can lead to burnout and also, a wanting to flee. Nursing interventions for moral distress. We want to make sure that we are providing an environment for private conversations, private time, for the patient, to be able to talk with family, to talk with healthcare professionals. We want to be affirmative to them, provide them a affirmation to take care of themselves, validate their feelings, identify their support systems, and then also initiate any kind of ethical consult when needed. Okay, so that, in a nutshell, is a little bit to know about spirituality, which you need to know in order to become an effective and a therapeutic nurse.